Hello, and welcome to today's webinar, Shockwave Treatment in Aesthetics and Erectile Dysfunction. This webinar is presented by Zimmer MedizinSystems Aesthetic Division. Hello, I'm Regina West, and I'll be moderating the webinar today. Before we begin, we'd like to note that this webinar contains sensitive content and viewers must be 18 years old or older. Also, a reminder that shockwave treatment for erectile dysfunction is an off-label application. At any point during this presentation and Q&A, you may submit questions by typing them in the Questions tab on your webinar control panel. Following today's presentation, we will cover those questions live. If there's not enough time remaining to answer all of the questions, answers to your questions will be emailed to you. And now I'd like to introduce the speaker for today's webinar. We have Dr. David Goldberg standing by. Let's bring him on camera now. Dr. Goldberg, would you please join us? Hello. Hi, Dr. Goldberg.
How you doing?
Very good, thank you. I'd now like to present a little background on Dr. Goldberg. Dr. Goldberg earned his medical degree from Yale University School of Medicine. He completed his dermatology residency and dermatologic surgical fellowship at NYU Medical Center. He has served as president as well as chairman of both the ethics and international committees of the ASLMS. He is past chair of the ethics committee of both the AAD and the ASLMS, and has been on the board of directors of the ASDS, AAD, and the ASLMS. Dr. Goldberg is a clinical professor of dermatology and former director of laser research and Mohs surgery at New York's Mount Sinai School of Medicine. He has published over 170 peer-reviewed manuscripts and has authored and/or edited 15 dermatology books. He's performed pivotal research studies in laser hair removal, non-ablative skin treatments, cellulite and skin tightening, erectile rejuvenation, dermal fillers, and new botulinum toxins. Dr. Goldberg is also an attorney, having graduated from Fordham University School of Law, where he currently serves as an adjunct professor of law and has taught a course entitled Advances in Healthcare Law. And if you're just joining us, I've just introduced Dr. David Goldberg, who will be speaking on shockwave treatment in aesthetics and erectile dysfunction. Welcome again, everyone. And Dr. Goldberg, thank you very much for being with us today.
Thank you for having me.
Thank you, Dr. Goldberg. And now we should be able to see your presentation momentarily. And we see your PowerPoint, and I will let you take over.
All right. Thank you so much, Regina. Hi, everybody. So this is a fascinating talk I'm going to give tonight. It's something I'm passionate about, and that is Z-Wave treatment, the Zimmer Z-Wave device that we use both in aesthetics and also in erectile dysfunction. I am an aesthetic dermatologist, as Regina said. This kind of technology can be used in multiple different specialties. So this is the device. This is the Z-Wave device, the Zimmer device. It's got a couple of hand pieces, one for bigger areas such as cellulite and one for smaller areas such as penis when we do erectile rejuvenation or erectile dysfunction treatments. So what is this all about? So this device puts out what we call ESWT. It's extracorporeal shockwave therapy. And what is that? That is the application of mechanically generated external sound waves. And we don't want to confuse that with so many other technologies that are out there that have ultrasound that are used for imaging or perhaps even focused ultrasound to create heat. Initially, this device, frankly, has been around for a long time, used to treat kidney stones and lithotripsy. Then on to physical therapy. It's been used in orthopedics a lot and also trauma and surgery because of its radial sound propagation. It's FDA cleared for pain. In my area for cellulite and to increase blood flow, and that's how we use it when we treat erectile dysfunction. It can clear edema and damaged tissues. We use it for all kinds of things where we're trying to get rid of ecchymosis or swelling. It gently pushes toward lymphatic drainage. It increases blood flow to an area. And the way it works both in orthopedics as well as in erectile dysfunction is it creates micro wounds, micro trauma, which stimulate a repair response. That leads to both collagenesis as well as and importantly in erectile dysfunction, angiogenesis, new blood vessel formation. So in aesthetics, most commonly we use the device following a variety of body contouring devices, whether it's cool sculpting or Vanquish or Ultra Shape or Sculpture, Quo injections for cellulite, where you want to get that blood flow moving. We use it all the time in those areas. We also use it when we do tattoo treatment with a variety of nano and picosecond lasers, because the blood supply and the blood flow created by ESWT makes the wound heal quicker and the results come along faster. Many other reported uses: lymphedema, edema, scarring, helps scarring actually, certainly breaks up adhesions from trauma or surgical procedures, capsular contracture used all the time in orthopedics, as I said, after lipolysis, liposuction, or post-chemical lipolysis, that's Kybella injections. I alluded to laser tattoo removal and a whole variety of cosmetic procedures, but increasingly we're using this device in the area of sexual medicine. So this produces radio sound waves. Let me get my screen here corrected. Hold on a second for me. There we go. This produces radio sound waves, and so it's different though than most shockwave systems. Most shockwave systems create their sound waves by striking the tip with a projectile, a bullet. So in this case though, that bullet is really big. That projectile is very big. It's that gray part you see in that cylinder. And because it's so big, it produces a lot of energy without a lot of force, and therefore it doesn't hurt that much. Which means it produces what we call soft shock technology. And why is soft shock technology so important when we treat erectile dysfunction? Well, it all has to do with something we all learned so many years ago, Newton's concept of F equals ma, a direct relationship between the mass, which is the projectile here, and the acceleration when it comes to force. So typically, if you don't use Zimmer Z-Wave, you're using that small hammer. It's like a tack hammer. Whereas with the Zimmer device, we're using what looks like a sledgehammer. So when you're trying to put a tack through something with a sledgehammer, it takes very, very little force. And therefore, there's not a lot of discomfort when we treat the penis with this. If you were to try to take that same force through a tack hammer, it takes so much more energy, it hurts so much more. So the Zimmer Z-Wave device is so different because the projectile, the sledgehammer, is so big, and therefore we don't need a lot of energy to produce the radial energy, and therefore there's not much discomfort. So on the left, you see that small pneumatic device. That's a typical device where so much energy is required. It hurts so much. Typically, you see that with shockwave therapy for kidney stones. In this case, electromagnetic energy on the right side, big, big projectile, not much energy required, minimal discomfort when we treat erectile dysfunction. So this is called Z-Wave technology. The pressure waves are transmitted through the surface of the skin. They spread radially into the tissue, and they can potentially treat a large, deep treatment area, for example, cellulite. And there you can see the handpiece. And there you see the energy spreading radially upon impact to the skin. A lot of our understanding of how this device works in angiogenesis goes back to Pablo Naranjo in Spain. He did LCCT images, liquid crystal contact thermography, and he showed when you treat cellulite with this, you actually see increased vessels, which you can see in that lower picture there. So the photos clearly demonstrate that Z-Wave improves circulation in a treated area. That's important for cellulite, and it's really important for erectile dysfunction. And so if you look at the ultrasound on the top and the ultrasound on the bottom, you see this overall improvement in smoother surface. The fat cells are smaller. There's a thickened connective tissue, and that's how it works in terms of improving cellulite, but in part because of the increased blood vessels. So here you can see an example where we use this in the aesthetic arena. Radial shockwave therapy activates the metabolic activity, stimulates blood circulation, production of collagen, and therefore reduces the appearance of cellulite. So this can be used as a primary treatment for cellulite, a never-ending problem for a lot of people, or it can be used as adjunctive therapy for anti-skin tightening device, Quo, collagenase injections, or liposuction. And you see before, look at all the dimples on her buttock and on her leg. She's never going to get rid of all. But you see after 3 sessions, pretty easy to do the improvement. Here uses a primary modality. So Z-Wave applications used by us and other practitioners, post non-invasive lipolysis, surgical lipolysis, liposuction, a lot of bruising, swelling, pain. Get rid of that with this. It's been used after abdominoplasty, brachioplasty. As I said, we use it after a variety of injectable agents. Kybella, which is a fat melter, can produce a lot of swelling. Zimmer Z-Wave therapy gets rid of the swelling. Quo is the collagenase injected into the dimples of cellulite. A huge amount of bruising will make it go away quicker with Z-Wave. And then nodules and fillers. Scars can be softened. And as I said, in orthopedics, capsular contracture. Let's get to the meat of what we do. This is an area that is growing a lot, erectile dysfunction. And I will just say from my perspective as a dermatologist, we treat both erectile dysfunction, but we also treat younger people who want enhanced sexual function, where they're actually perfectly fine, but they want enhanced sexual performance. But erectile dysfunction is defined as the persistent inability to achieve or maintain penile erection sufficient for satisfactory sexual performance. The incidence of this is huge. You can see this number by 2025, 322 million worldwide. Big, big problem. Often occurs in men starting at age 40. 50% of men at age 40 already have some degree of this. And most often, not all the time, but 80–85% of the time, erectile dysfunction is a blood supply issue for a whole variety of reasons: disease states, diabetes, hypertension, aging, or lifestyle. And you can see all the different possibilities. This is from Johns Hopkins Medicine. It could be prostate problems, type 2 diabetes, hypogonadism, hypertension, common cause, a variety of vascular diseases, elevated lipids, low levels of HDL, chronic sleep disorders, who doesn't have that, a variety of drugs, and neurogenic disorders. These are all the possibilities for erectile dysfunction. This device works in the overwhelming majority of them because they are vascular induced. And here's some more: it's Peyronie's disease, priapism, depression, alcohol use, lack of sexual knowledge, poor sexual techniques, inadequate interpersonal relationships. Suffice to say, this device is not going to help that one. A variety of chronic diseases, and then smoking, which exacerbates all of the other vascular issues. So accurate diagnosis is essential for the treatment of ED. You need to understand the likelihood for a successful outcome, because if we're trying to induce new vessels, which is what we are doing, it's got to be vascular induced, which, as I said, represents 80–85% of ED. So perfusion of the corpus cavernosum is extremely important and sufficiently contributes to quality erection. That's the problem here. And with Z-Wave treatment, it's possible to significantly promote increased perfusion and stimulate the formation of new vascular structures at the same time. That process is known as neovascularization. And the Z-Wave is clinically proven to enhance this process based on the science that we learned from cellulite. The reality is, even patients with severe ED who are taking oral agents, PDE5 inhibitors, Viagra, Cialis, and the like, also achieve significantly better therapeutic success. Depending on the degree of erectile dysfunction, an average of about 5 to 8 treatments are needed to achieve a lasting improvement in the erection. Typically, in my office, it's somewhere between 4 and 6 treatments. The therapies are roughly 30 minutes, could be 20, a little bit more than 30. And they're done up to 2 times a week. I am in the New York metropolitan area. It's impossible to get people twice a week. Generally, they come once a week, as I said, 4, maybe 6 times. The reason this is becoming increasingly popular is it's frankly a piece of cake. It's non-invasive. It has no downtime. As I said, it is nearly pain-free. It does do what we want. People get improved erections, more enjoyable sex, improves confidence. Outside of occasional, a little bit of swelling around the treatment, virtually no side effects, well tolerated. they get what they want: full erection, improved penile stiffness. You get the knee angiogenesis. Some of them still stay on their oral agents, but some of them actually totally come off them. So here comes the video. So get ready, get your kids away. So here's the treatment. So we put a lubricant on the area, and you can see we go over the entire penis. And you can see he's not even moving. So, and this is a younger guy who wants enhanced sexual performance. It does make a rather loud noise when you do this, which I'm not showing you here, but it's pretty easy to do. And as I said, 20, 30 minutes for the whole area. The entire penis is treated, and we also treat the area around the scrotum, as well as some of the suprapubic area, all trying to increase our blood vessel supply to the area. So here you see we treat the scrotum as well, because the idea is to induce this microtrauma, which leads to neoangiogenesis. And like I said, I mean, he's fully awake. He's obviously not even moving. Invariably, when these guys come in, they want to know, what they're going to have to do to tolerate this. They want to know if they have general anesthesia coming on board, if they have to take Valium, and the reality is we do nothing. So you've got that projectile within that handpiece that's putting forward that energy into the penis, into the scrotal area. And as I said, we even treat the suprapubic area. So this is an ideal tool in the aesthetic dermatology arena. It's an ideal tool in the urology arena, plastic surgery arena, or anybody that practices wellness for a whole variety of reasons. Because what it does is it increases short-term increase of blood vessel caused by the vasodilatation, and with a series of treatments, there is long-term improvement of the blood flow because of the new blood vessels. ED improvement typically lasts about a year, and so if we do these again 4 to 6, sometimes 8, but we are typically 4 to 6. I tell people expect to come back in roughly once a year for this, and it works. And happy patients, no doubt about it. And those happy patients then go on to do other things in our practice. So in aesthetics, as I said, not just ED, cellulite, following non-invasive lipolysis, post-plastic surgery, scar management, more. It's a class 1 device, so you can delegate this to virtually almost anybody in your office. It doesn't require a medical license to be operated, and the ROI is great because there are absolutely no disposables or per-use fee. Regina, it's all yours.
Okay, thank you so much for that really great presentation today, Dr. Goldberg. Let me take back the screen now, and we can get to the Q&A portion of today's webinar. Just one moment. Okay, so Dr. Goldberg, I just wanted to remind the attendees that if there are any attendees who haven't yet submitted your questions, I encourage you to do so now or at any point during the Q&A. So let's get to the questions. First question is, how long is the Shockwave treatment for erectile dysfunction?
So typically a treatment takes, if you ask the company, they'll say 30 minutes. Once I've done this enough times, and I'm doing this for years already, it's about 20 minutes to treat the entire penis, suprapubic area, and the scrotum. Okay,
you mentioned just now that results last about a year. Is that typical? Here's a question, how long do results last? And is it a year typical?
So it definitely lasts a year. There's no doubt about it. Having said that, this is very seductive stuff. It's almost like people who get Botox coming every 3 months. There are people that I've treated 4 or 6 times who 6 months into it say, I just want more. And since it's harmless and it makes people really happy, and I might add, yes, the men are happy because they're doing it, but so are the others in their lives. And so some people do come in at 6 months, but I tell everybody to expect to come back once a year.
Okay, great. There are some questions about cool sculpting in conjunction with Z-Wave. Do you use cool sculpting in your practice or Z-Wave after cool sculpting?
Yeah, I mentioned cryolipolysis because that's a generic term, but that is cool sculpting. So cool sculpting is the freezing of fat to lessen fat in the area, and it can take months and months and months for that to go away. And we speed that up by immediately after cool sculpting, treating them with Z-Wave therapy.
Okay. And that improves the results significantly? Or is it noticeably improved?
It's two parts. One is it makes the results come sooner, and two,
Right.
it actually improves the results, yes.
Okay. Are there other technologies that you think Z-Wave would make more efficacious?
Well, so any device used for non-invasive body contouring. And so that's going to include all of the different radio frequency devices. I mean, there's so many out there, Inmo, Luminous, Cutera's devices. BTL has the M-Sculpt Neo that remove some fat as well as to tighten the muscle. We use it as an adjunct to that. As I said, we use it post-Kybella injections. We use it after Quo cellulite injections. So anything that is used for body contouring of the abdomen, the thighs, or those areas, this is a great adjunct.
Okay, there are actually several questions coming in regarding the settings for the device for ED treatments as well as cellulite treatments. So could you go a little bit over device settings and maybe treatment durations and how they may differ for ED or a cellulite treatment?
So the more energy, the better. That makes sense, right? Having said that, penis is a pretty sensitive area. So somewhere in a range of 100 millijoules to 120 is what we typically do. For cellulite, we can sometimes do more than that. But some of the guys, especially the younger guys, they want more. And so we go a little bit higher. But figure around 100-ish for ED and a little bit higher for cellulite or post-body contouring because those areas are not sensitive.
Okay, and just to review, I know you mentioned this in brief in your presentation about the amount, how many sessions in a series for ED, and also there's another question about versus cellulite. How many sessions are there in a treatment series for ED and then for cellulite?
So ED is somewhere between 4 and 8, and I typically do 4 to 6. You can do them twice a week. In my world, that never works practically. So we do it once a week. So I tell people expect to come in roughly once a week. It's not an exact science. Once a week for about 6 weeks. In terms of cellulite, treating primary cellulite is different than treating post non-invasive body contouring procedures. So if I'm going to do cool sculpting, as someone asked about, then typically I'll do this once and maybe a second time in a month. But if I'm going to use Z-Wave as a primary treatment for cellulite, I treat them much like I do erectile dysfunction. They'll come in once a week for 4 or 6 weeks.
Okay, here's an interesting follow-up question to the settings question. Do the settings change as the treatment series goes along?
As I said, more energy, the better. And so it really depends on the patient. Now, this is a probably totally inappropriate comment I'm going to make, but men, and I'm including that group, are total wusses. And so women who have cellulite treated, they really tolerate high energies. Men who have erectile dysfunction treated don't necessarily do that. And so I do try to go higher each time. I always get away with that in women. I don't always get away with that in men.
Okay. Do you feel it's because it's a more sensitive area of the body, or the difference between men and women in general?
Well, it is a more sensitive area of the body, but I could make the argument that men who get Botox injections also are not as easy to treat as women are. So we'll leave it there with that Y chromosome.
Okay. So there are a couple of applicators that come with the Z-Wave device. Now, here's a question. Can the 39 millimeter applicator be used on the penis? Must I use the 15 millimeter? This must be an existing Z-Wave user.
Yeah. Well, certainly you can use the larger applicator. Having said that, it's a big applicator for a small area. And so I like the smaller applicator because it actually does hurt less. And you're applying the energy where you want it. So yes, you can use the larger applicator, but ideally use this one.
Okay, what do you charge for the series of ED treatments? Can you talk about that?
Yeah, so we typically charge, and I know this sounds like a strange comment, but it's partly based by size of the area because men come in all sizes. And so the range is between $1,000 and $1,500 per treatment.
Okay. Do you also provide the P shot in your office?
I have. It's not my primary treatment. I know it's very popular. I believe that Z-Wave is the real deal with a huge amount of science behind it. I think the P-Shot probably does something, but I look at it as being icing on the cake.
Okay. So have you ever used P-Shot in conjunction with Z-Wave in a treatment?
I have. I haven't done much of that post-pandemic, but we were doing some of that pre-pandemic because it was all over social media, so we were doing some of that.
Okay, so in your presentation, you mentioned some of the risk factors contributing to erectile dysfunction. Are there certain conditions that eliminate patients from treatment, from being able to be treated?
Certainly, and I alluded to some of them. So, if there are relationship issues, and that's why they can't have an erection, they're not going to respond to this. If they have neurological reasons, post-stroke, where they can't have an erection, they will not respond. But the overwhelming majority of men, are in that group where the vessels, without even diabetes or high blood pressure, they just get smaller with age. And so 85% of people are responding. Obviously, I know if they've had a stroke, but I make it very clear, if you're coming in because of relationship issues, you might want to seek therapy first and then come to me afterwards.
Right. Okay. So here is an interesting question again. If there's no response from the treatment, up to how many treatments may be done to try to
that's a hard one to answer. I've never seen that happen if you choose the right people.
Oh, wow.
Yeah, and so again, I had people on, oral agents. People were not on oral agents. I've treated some elderly men. Like everything else, the younger they are, the better they respond, the quicker they respond. But oh my, I have some 70-something-year-old men in the practice who, really get a smile on their face.
Okay, so there's a little bit of a follow-up to the question about the fees, the charge. Do you usually charge per session, or are you charging per series, like in a pack for the whole series as a package?
Yeah, that's a great question. So again, the fees somewhere between $1,000 and $1,500. We actually charge it up front because this is one modality of treatment where if they don't do a whole treatment series, they're not going to get the ideal result. And what I don't want to have happen is people treat once or twice, go out there and not be happy, and then frankly tell their friends. So we charge them up front, and therefore they come in, they do it.
Okay, and another question about the charge, but related to Z-Wave when added to cool sculpting. Do you charge extra for the added enhanced result that Z-Wave will produce with cool sculpting?
I've done both. There have been some patients who, up front in the consult, I'll tell them we're going to do both, and therefore I'm going to charge them for it. And then there have been patients who, when we didn't talk about Z-Wave ahead of time, and clearly they were not happy in about a month, and then we treated them for free. So I think that's a little bit a subjective decision, and I've gone both ways on that.
Okay, a couple of really interesting questions here about special cases. For example, what is the success rate with Peyronie's disease patients?
Can't tell you because I haven't done it. That's really for a urologist. So
okay.
I actually try not to treat Peyronie's disease as an aesthetic dermatologist.
Fair enough. Okay. And then here's more of a comment. It's not a question, but you may choose to comment on it. Diabetics are more challenged to treat, mainly poor response. Would you agree with that?
So I actually don't agree with that. I mean, that's a classic group that we're treating that's in the 50 to 60-year-old range. They have decreased blood vessels. I'm not talking about end-stage diabetics. I'm talking about the typical American, who's got, glucose intolerance, metabolic syndrome. They're on some agents for diabetes. Their vessels are smaller. They actually do respond, and they represent a good percentage of people I treat.
Okay, we do have quite a few more questions here. I hope you have a few more minutes to spend with us.
Yours.
Okay, fantastic. Thank you. back to the cool sculpting topic, do you feel that the massage is important following cool sculpting if you're using Z-Wave?
I do think it's important for a whole variety of reasons. One is I do think it does lead to a better, more uniform result. But two, and I'm sure the questioner knows this, right after cool sculpting, I mean, people's fat is almost like an ice cube. It's a very bizarre shape and feel. And when you do cool sculpting afterwards, it tends to soften that some. And so people feel better about the treatment to begin with. So immediately there's some improvement, and then there's better long-term results.
Okay, so it sounds like you have a lot of different applications for the Z-Wave device in your office, post-cryolipolysis, for cellulite, for erectile dysfunction, et cetera, et cetera. So the question is, how frequently are you using Z-Wave in your practice?
Well, so nobody asked about post-tattoo treatment, which we do a lot of laser tattoo removal. And
Right.
talk about frustrating. I mean, people, for the most part, are not frustrated after body contouring procedures. Z-Wave simply makes them get a better result. But there's a lot of frustration post-tattoo removal because it goes on forever. So we do that a fair amount. So Z-Wave really we use it as a primary device in cellulite, certainly a primary device in erectile dysfunction, but as an adjunctive treatment to all of those non-invasive body contouring procedures I talked about, as well as post-laser tattoo removal.
Okay. Would you care to elaborate on the post-laser tattoo removal in case people aren't familiar with that application, exactly what it's doing and when and how you apply the Z-Wave?
Yeah. So for those of you who know anything about laser tattoo removal, there are a whole variety of lasers used for tattoo removal. They're put into what are called pico or nanosecond domain pulse delivery systems, which means they deliver essentially a bolt of energy, either a billionth or a trillionth of a second. They blow up tattoo pigment, which is why tattoo removal lasers hurt. So they blow up that tattoo pigment, and then ultimately that pigment is removed by the lymphatic system. And so it becomes less and less obvious with time. Well, think about it. You treat them, and immediately afterwards, you treat them with Z-Wave treatment, and it hastens the lymphatic drainage, which we know from cellulite. And therefore, the results are better and they're quicker, and less sessions are often required.
Okay, and there are studies on that particular application with Z-Wave. If people are interested in further information, contact Zimmer MedizinSystems, and I'm sure that can be provided. Okay, Dr. Goldberg, back to some more questions. Do you use numbing cream before treatment? And I presume they're speaking about ED.
Yeah, I'm sure that's what they're asking about. Never. Yeah,
Never.
I've never used numbing cream.
Oh, okay. It's just not needed?
Yeah, I don't need it. I mean, you could. I guess you could if someone wants it. It's not going to stop the benefits of the treatment, but I have never used it.
How do Z-Wave treatments alone or Z-Wave in combination with other treatments compare with other technologies that you've used for cellulite?
So if you look at Quo injections, which help the dimples of cellulite, I mean, that's the primary mechanism by which that works. And so I don't look at Z-Wave as replacing Quo. What Z-Wave does is, for those of you who have injected Quo into the dimples of cellulite, it creates a huge amount of black and blue, a huge amount of ecchymosis. And patients hate that. And so if you do Z-Wave afterwards, it goes away much quicker. So I use Z-Wave in that group as an adjunct. Having said that, we have estheticians who have used Z-Wave therapy as a primary treatment for cellulite, but that's more for the rippling, not so much for the dimples.
Okay, a couple more. There are a lot of similar questions coming in here. I'm trying to filter them for you. One doctor would like to know, do you use a moisturizer before the treatment for ED?
Well, you saw in that video that we use the lubricant there. It's really, frankly, more for me than for the patient. It just makes that that handpiece glide better. But I've done it without any lubricants at all. So that doesn't have any impact on treatment success. It just glides better. For those of you who've used IPLs, for whatever you use them for, sometimes you use some sort of lubricant. It doesn't make the thing work better. It just makes it glide better.
Right. Okay. You're stuck with us for a couple more minutes because these questions are still coming in, Dr. Goldberg. I'll shoot you a few more questions and then we'll end the webinar. So this may be a little bit of a mathematical proposition, or maybe you know off the top of your head. How many total shocks would you do within 20 to 30 minutes?
I generally deliver about 1,500, somewhere in that range. I've gone up to 3,000, but that's my range. 1,500, 2,000 is typical.
Okay. Here's a question about plantar fasciitis. Have you ever used Z-Wave for that condition? And if so, what are your settings?
Oh, I love that. Plantar fasciitis. It's enough that I even know what that is because I've had it, but no, I've never used it for that. That is an orthopedic or a podiatric use, not a
Yeah,
dermatologic.
there is some success in treating that condition.
Well, no doubt about it, because yeah, it's breaking up that. I'm not surprised in the least. Yeah.
Okay, well, thank you so much for spending all of this time for your presentation and for answering some questions for us, Dr. Goldberg. It was very, very interesting. Thank you so much again for your time.
Have a great night, everybody.
Okay. So I'd just like to share one final screen here with you. If anyone would like more information about Z-Wave, Z-Wave Pro, and Z-Wave Q, please visit Zimmer MedizinSystems website at www.zimmerusa.com. Zimmer MedizinSystems also has an assortment of waiting room materials available for you to browse on the shopping site at shop.zimmerusa.com. If you have any questions, please send an email to info@zimmerusa.com. And this concludes today's webinar. Thank you very much for attending. A recorded version of this webinar will be emailed to all attendees so that you may review this information at your leisure. Good night.